Hi guys! In this video, I'm going to discuss the use of orthopedic boots, those big chunky boots for Achilles pain or Achilles tendinopathy. We're going to look at why it may be prescribed to you. Second, also why you really should not be wearing it for too long if you are going to use it. And then thirdly, if you're not going to use a boot, what's a better option actually rather than using one of those boots? Now, for those of you who don't know me, my name is Maryke. I'm one of the physiotherapists from treatmyachilles.com, where you can get online physiotherapy assessment as well as treatment for your Achilles injuries. So have a look at the description of this video if you want a link to our website. Okay, so why would somebody prescribe a Achilles boot or one of the walker boots for you? It's often when somebody has a really painful Achilles tendon that a doctor would prescribe that to a patient to see if they can calm the tendon down. Because as soon as you immobilize the foot in there, it means that you don't use it. It can really decrease the pain, because we know that rest is a good way of calming pain down in an Achilles tendon. But now you've got to remember that part of the problem with this, or the main problem with this tendon, is that it's not strong. It needs to be strengthened up to be able to cope with the loads from walking and running and all the activities you want to be doing. Now, if you stick it in that boot for too long, rest is brilliant at calming the pain down, but if you rest for too long, you actually start to weaken the tendon. So you're losing some of the strength that you've got in your tendon already. So wearing an orthopedic boot to calm the pain down should only ever be used as a short-term solution and never longer than 2 weeks. So to wear it for 4 weeks is way too long, unless, remember now, this is for Achilles tendinopathy and Achilles pain. It's not when you've got an Achilles tendon tear. If you've got a tear, then a boot is the correct way to treat it. And you can see we've made a video about that in the past. But if it's Achilles tendinopathy and there's no tear involved and it's just a painful Achilles, really maximum 2 weeks that you need to wear that boot. Otherwise, you're weakening your tendon. Now, we don't ever prescribe boots to our patients, and the reason for that is you do not need to wear a boot to get the tendon to calm down. You need to just decrease the activities that really irritates it. So a really good way of doing that is if you wear a shoe with a heel on it, so like trainers with a heel toe drop of about 10-12 degrees, and you can even stick a heel lift or heel raise in there. So by lifting the foot up, you're taking the strain off the Achilles tendon and you're allowing it to recover. Second, reduce your activities. It may be that you're currently just walking too much for what the Achilles can do, or trying to run with a painful Achilles. Just stop. Be in shoes that offload it and just gently move around. That would be much better for your tendon than being stuck in a boot where you can't move, because your joint will still move, your tendon will move a bit, so it's getting a little bit of it's getting its blood circulation and things, and you won't end up losing the strength that you've currently got. So it's really important to, before you consider wearing a boot, really try to rest it and offload it while being able to remain active. Now, there's a worrying trend that I'm seeing, that patients are not only prescribed a boot, but they're being prescribed the boot, stuck in there for 4 weeks, and corticosteroid tablets that they need to swallow. So again, steroids are very good at reducing pain, but we also know that they're very good at damaging tendons, because they stop the tendon from producing enough collagen fibers to actually heal itself. And I've made a whole video on the topic of corticosteroids and why it's not good to take when you've got an Achilles injury. I'll link to it here. So the combination of wearing a boot for 4 weeks, which then degrades your tendon because you're not using it, plus steroids, which makes the tendon produce fewer collagen fibers, so it's more difficult for it to recover, then means that you may very likely, and this often happens, the patient then gets back to the doctor after 4 or 6 weeks. They're not really any better because they haven't done anything to make it better. They've just offloaded it the whole time. And then the doctor says, "Oh, I think you probably need surgery." Now that is ridiculous, because you've not even tried to load it yet and do careful load management and try to strengthen it up. So you cannot go from wearing a boot and steroids directly to surgery. You need to be able to first test, can I somehow get to walking without pain? Even if I have to wear a heel, even if I have to wear a lift in my shoe, and can I start with some gentle strength training? Another thing that I see is people tend to go from the boot and people give them exercises that's just too hard for them. They go into single leg heel raises and things, or over the side of a step immediately. And the tendon's just not ready for that, especially if it's been in a boot the whole time. You've got to start with gentle double leg heel raises, and probably in shoes with a heel on them to start with, to get the strength back into it. So if you've been prescribed a boot, make sure you do not wear it for longer than 2 weeks max. And when you come out of it, ease into activity, start wearing a shoe with a heel on that you still kind of get the tendon used to movement again, and make sure you could get good rehab advice. Excellent. Let me know if you've got any questions, but if you need more help with an injury, you're welcome to consult one of us via video call. The link to the website is in the description of this video. Take care.